Welcome to the lecture on topical preparations, which are products that are applied on the skin. In this lecture, we will be looking at the structure of the skin, factors affecting the absorption through skin, formulation of the different types of topical products which are ointments, creams, and gels, and I'll also introduce a route of administration which is the transdermal delivery system. The skin is often referred to as the largest organ of the body. The skin has three layers: the epidermis, which is the outermost layer, the dermis, which contains blood vessels, nerves, and proteins such as collagen, and the subcutaneous tissue, which is the fat tissue and serves as a cushion for the dermis and the epidermis. The outermost layer of the epidermis is the stratum corneum, which is made of dead skin cells. Drugs can be applied to the skin for different purposes: to treat the skin surface, for example sunscreen and insect repellent; to treat the stratum corneum, for example moisturizers; to treat the deeper layers of epidermis and dermis, for example anti-inflammatory or anesthetic creams; to treat skin appendages, which are the hair, oil glands, and sweat glands, for example antiperspirants; or to deliver a drug through the epidermis and dermis into the blood to be carried to the rest of the body, for example nicotine patches for people who are trying to quit smoking. This slide shows the different areas of skin that are treated and the possible purposes of treatment. There are three pathways for molecules to penetrate the skin. In the intercellular route, molecules pass through the spaces between the dead cells. This is the predominant route. In the transcellular route, molecules directly pass through the dead cells. This is the path of greatest resistance as the molecules need to penetrate the cell membranes and cell contents of the dead skin cells. In the transappendageal route, molecules pass through sweat glands or hair follicles. Since sweat glands and hair follicles occupy only 0.1% of the total human skin surface, the contribution of this route is considered to be small, although it is still important. Several factors can affect the absorption of drugs through the skin. The size of the molecule. The smaller the molecule, the better the penetration. Skin condition. The stratum corneum is the major barrier to absorption. During inflammation, for example dermatitis or psoriasis, the skin barrier is reduced and absorption through the skin is increased. Regional skin size. Different areas have different thicknesses of the stratum corneum. The thinner the layer, the better the absorption. Circulatory effects. The better the blood flow to the area, the better the drug will be absorbed into the systemic circulation. Skin hydration. When the skin is well hydrated, absorption is improved. Temperature. Increased temperature increases the penetration rate of the drug, and the use of penetration enhancers in the formulation also helps to increase percutaneous absorption. There are many different types of dermatological formulations. Some topical preparations come in liquid form. Soaks and baths may contain active ingredients in aqueous solution or suspension. Sometimes water-miscible solvents are added. Lotions are usually oil in water emulsions, but may sometimes be aqueous solutions or suspensions. After the lotion is applied to the skin, water evaporates and gives a cooling and soothing effect to the skin. Therefore, lotions are useful for treating inflamed skin. Liniments are alcoholic or oily solutions or emulsions which are meant to be rubbed or massaged onto the skin. These should not be applied to broken skin. Liniments may be used for analgesic effect, meaning pain relief, rubefaction effect, meaning it promotes blood circulation and causes the skin to turn red, or stimulating effect, which provide a cooling or numbing sensation. Tinctures, paints, and varnishes are solutions of active ingredients in volatile solvents such as industrial methylated spirits, acetone, or ether. After application to the skin, the solvent evaporates quickly and leaves a thin film of drug on the skin. These formulations are usually meant to be applied onto a small area, for example, antiseptics like iodine. Most topical preparations are semi-solids, such as creams, ointments, gels, and pastes. Creams are semi-solid emulsions meant for external application. They can either be oil in water or water in oil emulsions. Oil in water emulsions would be less oily and easier to remove by washing. For example, aqueous cream. Water in oil emulsions are oilier and usually more moisturizing. For example, urea cream. In general, ointments are more greasy and viscous than creams as they contain a higher proportion of oil. They usually, but not always, contain medicinal substances. Ointments are emollient, meaning moisturizing. Occlusive, because the oily layer prevents water from evaporating from the skin. And they are used for applying medicines to the skin. Later on, we will take a closer look at the different ointment bases which have different properties. Gels are transparent or translucent, non-greasy, semi-solid preparations meant for external application to the skin or mucous membranes such as the mouth or the eyes. To achieve the gel structure, gelling agents must be added. Gelling agents are polymers such as cellulose derivatives such as carboxymethylcellulose and natural gums such as tragacanth. Pastes are ointments which contain large amounts of finely powdered medicaments. The presence of the solid powders causes paste to be stiff. Pastes can form a protective barrier on the skin and they are poorly occlusive, enabling the skin to breathe. An example of a paste is zinc oxide paste, which is used to heal and soothe diaper rash. Besides liquid and semi-solid preparations, other topical preparations include powders and aerosols. Powders for external use are usually described as dusting powders. They are applied to skin folds to dry, protect, and lubricate the skin. Aerosols are powders or liquids that can be sprayed onto the skin. We looked at ointments briefly earlier. Different ointments have different properties depending on the type of ointment base that is used. There are 4 general classes of ointment bases according to the United States Pharmacopoeia: oleaginous bases, absorption bases, water removable bases or emulsion bases, and water soluble bases. Oleaginous means oily. Oleaginous bases are anhydrous, meaning they do not contain water, greasy, and occlusive, preventing the evaporation of moisture from the skin. Because they are occlusive, they have a moisturizing or emollient effect. Because oils don't mix well with water, oleaginous bases are difficult to wash off with water. Water or aqueous preparations also cannot be incorporated into the base. Usually, ointment bases are made of hydrocarbons from petroleum. These hydrocarbons do not penetrate the skin. An example is petrolatum. Some ointment bases are made from vegetable oils and these may possess some power of penetration into the deeper layers of the skin. The main disadvantage of oleaginous bases is its greasiness. It can stain clothing and is difficult to remove. Absorption bases are also greasy, but they are able to absorb additional water to form water in oil emulsions. Absorption bases contain a hydrocarbon base and an emulsifying agent which enables it to absorb water. Small volume of aqueous solutions can be incorporated into the base to form water in oil emulsions. Because of the greasiness, absorption bases are emollient, occlusive, and difficult to wash off, although it is easier to wash off compared to oleaginous bases. An example of an absorption base is hydrophilic petrolatum, which contains cholesterol as an emulsifying agent. Water washable bases are oil in water emulsions and are more correctly called creams. They are described as water washable because they can be easily washed off from the skin or clothing with water. This makes them more popular than other types of ointment bases. An example of a water washable base is hydrophilic ointment. Water-soluble bases, as the name implies, are made up of water-soluble components and can also be referred to as gels. They have no oily components, therefore they are completely water-soluble and greaseless. The major component of water-soluble bases are polyethylene glycols or PEGs. An example of a water-soluble base is polyethylene glycol ointment. Now that we've seen the different types of ointment bases, how do we select a suitable base? The choice of an ointment base depends on many factors. The rate of release of the drug, which is influenced by its solubility in oil and water. Whether or not the drug is meant to be absorbed by the skin. Bases that are more penetrating or hydrating can enhance drug absorption. Whether an occlusive effect is desired. Whether the drug is stable in the ointment base. Many drugs are more stable in oil than in water. The interaction between the drug and the ointment base. Whether or not the base should be water washable. And the type of surface to which it is applied. For example, whether it will be applied to unbroken skin, wounds, or mucous membranes. The preparation of ointments depends on the type of ointment that is being prepared. The objective is to disperse the drug uniformly throughout the vehicle. The drug materials are either in finely powdered form or in solution before being dispersed in the vehicle. Two methods can be used, trituration and fusion.
Trituration is useful when the medicament is a solid that is insoluble in a base or a liquid present in a small amount. Trituration is carried out by mixing on an ointment slab or in a mortar and pestle. I won't go into the details, but I will post a link to a YouTube video demonstrating trituration on an ointment slab.
Fusion is used for larger quantities of ointment or when the ointment contains waxes with higher melting points. The materials with the highest melting point are first heated to produce a melt. Then additional materials are added with constant stirring during cooling until the mixture is congealed. Fusion can be used for large-scale production and produces a uniform product. However, heat can cause discoloration or degradation of the base or drugs. Also, sometimes the ingredients with high melting point may solidify first, resulting in lumps in the ointment. As mentioned earlier, creams are either water in oil or oil in water emulsions. Therefore, they are prepared in the same way as other emulsions. How about gels? What goes into a gel? The gelling agent and liquid medium are necessary to form the gel, and of course you have the active ingredient, preservatives, and other additives. Many materials function as gelling agents, including carbomer and cellulose derivatives such as CMC and HPMC. The active ingredient may be a drug or herbal product. Water is usually used as the liquid medium. Sometimes, other water-miscible solvents such as polyethylene glycol may be used. Preservatives such as parabens may be added, and other additives such as EDTA may be added. Most medicated topical preparations do not allow substantial amounts of drug to be absorbed into the bloodstream. Transdermal delivery systems are dosage forms that, when applied to the skin, will deliver drugs through the skin into the systemic circulation. I'll just mention them briefly. A transdermal delivery system typically comprises an outer covering, a drug reservoir, a means of controlling drug release, for example through a membrane, contact adhesive which allows the patch to adhere to the skin, and a protective liner which is removed before the patch is applied to the skin. Transdermal delivery works by diffusion. The drug diffuses from the drug reservoir to the skin and then into the bloodstream. Since the skin is an effective barrier which prevents foreign substances from entering the body, only small molecule drugs which can penetrate the skin easily can be used. To overcome the difficulties of drug transport through the skin, alternative methods of transdermal drug delivery are being explored. One method is iontophoresis, which delivers the drug into the skin via electrical repulsion of ionized drug molecules. Another method is the use of microneedle arrays which can penetrate the epidermis but do not reach the dermis, which contains sensitive nerve endings. We have come to the end of the lecture on topical preparations. In this lecture, we have looked at the structure of the skin, factors affecting absorption through the skin, formulation of the different types of topical products which are ointments, creams, and gels, and we've briefly looked at the transdermal delivery system.